Hip pain and groin pain is mostly due to hip osteoarthritis, which is the second most common form of osteoarthritis after knee osteoarthritis. Prevalence of hip osteoarthritis has increased by 113% in the past 10 years. Treatment for end-stage osteoarthritis at the hip joint is a hip replacement surgery. At Navrang Hospital, we do a direct anterior hip replacement in which we preserve all the muscles in the front of the hip joint, split the capsule and get the arthritic head out of the hip joint. We prepare the acetabulum with different reamers and fix titanium cup with a plastic liner at the acetabulum. After which, we prepare the femur bone and a titanium stem is fixed in the femur with a metal or a ceramic ball over it, and the hip joint is reduced to check final range of motion and stability, and the wound is closed in layers with a muscle preserving approach. Here is a case of a 23 years old young male with avascular necrosis at the hip joint who was treated with an uncemented total hip replacement on the right side. This is another case operated on both sides for a total hip replacement surgery, and the patient on 2 months follow-up is able to perform almost 90% of the activities at both the hip joints. The patient is able to do straight leg raise in almost all the 4 planes, and the strength in the muscles is almost normal compared to the pre-operative strength on both the sides. Our mission is to keep the people moving, and we ensure that the hundreds of thousands of patients that we operate for a hip replacement surgery each year get the movement that they deserve. If a patient sustains a fracture in an operated hip replacement surgery which leads to severe pain and disability, then this fracture at the total hip can be revised with a revision total hip replacement. If an old implant at the hip joint fails or gets broken, then again it can be revised with a revision hip replacement surgery. The implants that we use for our patients are from Debut Johnson & Johnson. These implants help our patients return to their activities sooner and keep them active longer. They provide stability and reduce the need for revision surgeries, and also reduce the need for readmissions in our patients.